he's going to give us a speech about the drawing survivors with a near-death experience are not crazy. Dr. Avramidis, please.
Hi, thank you very much for coming today. Thanks for the invitation. I'm very happy to make this presentation in Greece, and I'm especially happy because a very good friend of mine has just arrived to the class, Daniel, who is sitting on the back. He has actually had a near-death experience in his life, and I haven't spoken with him if he would be willing to talk about this, but he's a person who is always sharing his experiences. The 10 minutes time frame is very short to discuss and talk about this phenomenon, but I will try to do my best. So the overall message that comes out from this presentation is that the people who had this experience are not actually crazy. This phenomenon exists. So let's go step by step to speak about this. There are very often comments of drowning survivors that said that I was watching my body floating above the emergency situation, and there was someone on the floor resuscitated by the lifeguard or other paramedics. And then I realized that this body was mine. And due to the advances of resuscitation and defibrillation the last several decades, the number of people who die instantly or temporarily and then they come back to life has increased. So the resuscitation methods have made possible to the researchers to come across to these people and come and take useful information from what is likely to await us on the other side. So, to give you some numbers, because we understand with numbers better the situation, about 1 million people every year are likely to have near-death experience after a drowning incident. If you want to make a better and more global realization, you will realize that it's 1 million only from drowning. If you will add heart attacks, spinal injuries, car crash accidents, other serious illnesses that may take at home or in the hospital, the people that come back are several millions every year. So, if you are a doctor, if you are a nurse, if you are a lifeguard, if you are someone who is taking care of patients and come across to these people, it's not very good treatment and practice to say, oh, it was just a dream, it was a hallucination, it was the influence of medication, you have taken drugs. This is not a good response to someone who wants to take care in a good quality a patient. So, we realize after all these initial explanations that these people are not illogical, are not pathological, they are not crazy. The phenomenon exists. So what I'm going to say in this presentation is I'm going to give you a brief description of the near-death experience characteristics. There are 16 characteristics that some survivors are likely to have. I will give you a small description of two accounts. I will give you short recommendations for lifeguards or doctors. And then if we will have enough time, I will show you scenes from two very good films that describe this phenomenon. So about the characteristics. When you are in this situation, you are likely to have thought, you are thinking in a very fast way. you can see scenes passing in front of your eyes like a film. And I am sure that you might have heard this expression, that my whole life has passed like a film in front of my eyes. You have entered into another unearthly world, and you are feeling joy. Your senses are vivid, more than usual. You have feelings of peace. Everything is pleasant. You might meet a mystical being or a presence. This is something that makes people feel excited when they come back. In 90% of the cases, they have some happy meeting with a being, a bright light that surrounds them with love and compassion. You might see deceased spirits or deceased relatives or even deceased pets, deceased animals that you had in your life. You might meet religious figures, Jesus or other religious figures. You have a sense of harmony and unity with the universe. You feel one with the universe. And you have a feeling that you are surrounded by this brilliant light. You understand everything. You have an awareness of things that are going on in a different place. So if, for example, I drop down here unconscious, no breathing, and my heart stops beating for some time, and then it's likely that I might get out of my body, pass through the wall, and see what is going on the next room. So the argument that you have dreamed it was a hallucination or the influence of medication is not really a good explanation of what's going on. Because if something unusual was happening in the next room, and I describe the whole thing, you cannot really explain it saying that it was a dream. And then you can feel a separation of your body, which is called out-of-body experience. So let's see two stories. This is actually this young girl. Is a good friend of mine whom I met in 2012 when I was president of the International Aquatic History Symposium and Film Festival in Florida. And I met this lady who was in her 55 years old, 60, I'm not sure. Wonderful lady. I could recognize her among hundreds of people. And then 2 years later, someone told me that she had a near-death experience. A little while after this photo was taken. So she was unconscious after drowning, and the hospital took her the ambulance took her to the hospital, and someone was holding her. And then when she came back to life, she described everything that was happening. And the people could not believe how could possibly know all these things. In another incident, this story describes a young boy who was swimming at the swimming pool, and he fell and drowned. So his older brother jumped into the water to initiate a rescue. So the small brother is climbing on the shoulders of the older brother and gets out of the swimming pool. Now, the older brother, the rescued brother, is drowning. The lifeguard is getting into the water, pulls the child out, and starts resuscitation. The mother is panicked, looking the whole emergency situation. And when the drowned brother comes back to life, the mother is asking the other young child, "Where have you been when your brother was in this terrible emergency situation?" And before this young boy replies, the older brother says, "He was hiding behind the door at the toilets, in the changing room. I was floating above the whole scene, and I could see him hiding behind the door. The young boy admitted that yes, I was there. The mother freaked out and threatened the boy, "Don't ever talk about this, otherwise I will punish you." So you realize that when you do not have enough information about this, you are thinking, crazy, he's not good, he has lost it. Let's not talk about this, because we are afraid of this. In another case, a young boy had fallen in the water, he drowned, the paramedics arrived, and when he came back to life, he said that I met my little brother who was over there, where I just was. But who was this little boy? I never had a brother. So their mother freaked out again. She was actually embarrassed, that was the appropriate term, because she admitted in front of the paramedics that when she was 14 years old, she had aborted a child because she was too young to keep it. And that young boy, when he was in that state of the other realm, had met this boy who said, "I am your brother." So things like this are making you wonder that this actually exists, and therefore we need to be able to have enough information to cope effectively with the people that experience this wonderful phenomenon. 90% of the people who have come across to this phenomenon are very, very happy, because it was a wonderful experience. It is only 10% of the people that had an unpleasant experience, the distracting, hellish, like a hell experience. So what do? I could speak more, but the time was not enough. So I have kept only these two questions, these two responses. So when someone is coming to you after an emergency situation, then you can ask, during your drowning episode, did something unusual happen to you? They might say no or yes. If they say no, then your response would be like this: you are possibly belonging in the great majority of people who have experienced nothing. But even in these cases, these people later on have started having some memories of an unusual event. If that happens to you after a little while, or even after years, and you would be willing to discuss and seek counseling, please come in touch with me, and then I will give you directions so you will be able to cope with this. Otherwise, they will feel afraid, that people will feel that this person is crazy, and they will have many questions for many years. If this person replies with yes, then you can say, would you like to talk about it? And as you might have heard in your studies, when you ask a question, you need to make sure that the question is not requiring a yes or no response. So make people feel comfortable and allow people to express their feelings without judging them. And then at the end, you can suggest useful information that may be able to help them. So such information could be the near-death experience while drowning book that I have co-authored with the president of the International Association for Near-Death Studies and the editor of the single international journal that is dedicated to the phenomenon, my good friend Jan Holden. And you could also access to websites that are very comprehensive and informative, because they have free audiovisual and other materials useful for every kind of situation. The first is the website of the International Association for Near-Death Studies, and the other one is the Near-Death Experience Research Foundation that has hundreds, if not thousands, of stories. So you will actually make these people feel comfortable, because they belong to a huge group, international group, of gifted people who came across to this phenomenon. Therefore, they will not feel isolated. I was going to recommend you those two very nice Hollywood films. The one is talking about a non-drowning situation full of near-death experiences. Heaven is for real. He's talking about the experience of a young boy. And the other one is talking about a drowning episode as well as other phenomena. This was directed by Clint Eastwood. But if we have time, as you do not have, I was going to show you clips from the films. But here we are at the end. Thank you very much. If at the end there will be time for questions and more about this, we will have the opportunity to expand on this.
Right now, if someone has a question.
Do you have questions now?
So you discounted oxygen deprivation, and secondly, that the brain, even after you stop breathing or your heart stops, can still, have a sense of what's happening around,
Yes.
comprehend what's
Yes.
going on. And you say about the next room, but if you're hearing
Yes. Yes.
what's going on, you
Yes.
can almost picture it.
Welcome. This is a very good point. This is a very good question. Before we published the book, the second title, the subtitle was "Death is not the end of consciousness." But then my colleague, Professor Jan Holden, said this is not correct. Dying is not the end of consciousness. We cannot prove that after death life exists, because to be able to do that, we would need to interview someone who died and remained dead. This is impossible. But we know that during the process of death, at this curving point, while they're dying, it seems that consciousness still exists. And this is what we say when we say dying is not the end. Because I've heard stories where a friend of mine had his father in this operation theater, in emergency care unit. He came out of his body, he went to another room. I know you will not believe it, but the source is very serious. He saw the doctor having sexual affair with a nurse in another room. And then, the next day, he said to the doctor, I would never I would never expect something from you like that. It was not very good of you doing these things with the girl. And he said, how do you know? You were unconscious in the emergency care unit at that time. How would you know? And he said, you see, with what you are telling me, you admit actually that this has happened while I was in this situation. Strange things. Louder, please.
Yeah. I have read the work of Dr. Parnia. Yes.
Some Parnia.
Doing research, and another doctor. I'm not sure about the name. I think it's Dr. Moore. And he did research because he's a doctor in a hospital, and he saw the patients that died. They were in the machines, and they were dead. There was nothing there. And they came back to life after all the situation, and they thought about things that happened to another room, about with nurses and all this stuff. And he published work in journals. It's a published work. So, and he explains about that someone that has drugs before he dies, he can't remember the experience because of the effect of the drug. And those that they remember the experience is because they don't have the drugs. So they are pure of drugs and everything like this. Yes. And he explains it scientifically, and he has found specific brain region that has to do with near-death experience. And if after an accident someone has a bump there or something, or not damage, not
It's working faster.
A hit in the specific region, then without being dead, he's experienced the near-death experience.
I obviously found it fascinating, and I'm sure most people did, and I am assuming you get all sorts of reactions, ranging from disbelief to emotional reactions maybe. I have a question, and maybe with all your studies you can answer that. Have you noticed if it's a universal phenomenon? Have you come across similar experiences across countries?
Yes, good question. It is a universal phenomenon. Of course, the research has been focused mainly on Western society, but as the years pass, there are more researchers who are trying to explore similarities and differences in other nations and other parts of the continents. So far, although the anecdotal cases are millions, if you Google near-death experience, you will see hundreds of books, hundreds of videos in YouTube, and so many stories in other forums. But the scientifically examined cases are about more than 3,000 from several continents, maybe 4 continents if I remember well, to different cultures.